Hello everyone. For this presentation on cultural safety in medical surgical nursing, which will be presented by myself, James Gazy, Meg Desfenta, Victoria Boachi, and Alwyn Bravo. Introduction to cultural safety. Cultural safety has become an essential part of modern medical surgical nursing because patients today expect care that is respectful, equitable, and centered on their needs. The concept originated in Canada through Indigenous nursing education and focuses on creating an environment where patients feel free from discriminations and genuinely respected for who they are. In acute and surgical nursing, where patients may already be anxious or vulnerable, culturally safe care helps build trust and leads for better health outcomes. Importantly, cultural safety is not just about learning the facts about different cultures. It requires nurses to reflect on their own assumptions, acknowledgement, power imbalances, and recognize how systemic inequalities influences the nurse-patient relationship. Now, what are some of the safety trends? A key distinction that is culturally competence is not the same as cultural safety. While competence focuses on learning about others, cultural safety requires nurses to examine their own beliefs and the bias built into the healthcare system. The Canadian Nursing Association emphasizes that cultural safe care is determined by the patient's perception of interaction, not the nurse's intention. Over the past 2 decades, a lack of culturally safety has been linked to ongoing health disparity in Canada, especially among the Indigenous and the racialized groups. Research continues to show that many individuals feel their needs were dismissed or overlooked because of prejudice or communication barriers. These concerns have pushed cultural safety to the forefront of nursing practice, influencing education standards, clinical guidelines, and health system policies. The Alberta Health Service has incorporated culturally safety and humility into its Indigenous health programs, and the National Nursing Education Standards now require inclusion of reflexivity, relational practice, and anti-racism. Where nearly a quarter of Canadian population born outside the country, the need for cultural safe medical surgical care has become both a professional expectation and an ethical responsibility. By embracing cultural safety, nurses contribute to reducing systemic discrimination and ensuring every patient receives care that respects their identity and lived experience. I'll now hand over to make this continue.
Thank you, James. Building on what you explained about cultural safety and why it's becoming a national priority, I will now talk about why this matters in Canadian context and its benefit in patient care. In Canada, we continue to see health gaps that are linked to systemic inequities. Indigenous people remains more likely to be hospitalized for preventable conditions. Many racialized Canadians report not having their health concerns taken seriously. Because of this, cultural safety has become part of nursing education and clinical standards. When cultural safety is practiced, patients communicate more openly and trust their care team. Research shows improved adherence to treatment plans and better post-surgical outcomes. Patients are more likely to follow instructions when they feel heard and respected. Now I'm going to give you a realistic scenario of how cultural safety might appear in real situations. For example, imagine a patient admitted for abdominal pain and English is not their first language and they came from a culture where people don't openly express their pain and they prefer to keep it inside because speaking up is seen as embarrassing. Without cultural safety, the nurse might think the patient is quiet or not reporting symptoms properly. But this is with cultural safety, safe approach like asking open-ended questions, sitting at eye level and offering interpreter, the patients begin to share more. They explain when the pain started, what they have tried at home, and how worried they actually are. This completely changed the assessment and leads to safer care. For nurses, cultural safety builds stronger teamwork and promotes a deeper understanding of social determinants of health. It encourages reflection, collaboration, and helping nurses provide more equitable and holistic care, especially in busy medical surgical units. In medical surgical units, we work with patients from many different backgrounds in fast-paced situations. Cultural safety helps the nurse avoid misunderstandings when patients describe pain, symptoms, or treatment preference. It also supports a safer discharge planning because we can identify social factors like language barrier or home support that might affect recovery. This leads to smoother teamwork with physicians, social workers, and families. Another important part of cultural safety is recognizing power imbalance. In healthcare, nurses hold more authority because we direct care, give information, and make clinical decisions. Patients from marginalized communities may feel they cannot speak up, even when something is unclear. Cultural safety reminds us to shift that power by involving patients in decisions and giving them space to express their concerns. This strengthens patients' autonomy and reduces the risk of misunderstanding, especially in fast-paced environments. That covers the key benefit of cultural safety for both patients and the nurse. Now I will pass it over to Victoria, who will continue the next section and explain how cultural safety is applied in practice.
Hello, everyone. My name is Victoria, and I'm presenting on challenges in cultural safety. We have so many challenges, but I would like to talk about this. Even though cultural safety has many benefits, there are real challenges too, and not all nurses receive adequate training. So reflecting on the personal biases can feel uncomfortable. There is also race. That organization treats cultural safety as checkbox rather than embedding it meaningfully into practice. So, looking at the future implication, moving forward, cultural safety must be a lifelong learning process. It aligns with the Truth and Reconciliation Commission calls to action and supports ethical, patient care centered. Nurses also play a key role in reducing health inequities and supporting social justice. Why am I saying this? Because looking at the Canadian impacts, in Canada, several provinces uses structured Indigenous culture safety training program. So evidence is showing improvements in trust, communication, and patient satisfaction. Studies also report reduced rehospitalization when care is culturally safe. Thank you.
Global impact of cultural safety. Globally, cultural safety began in New Zealand through Maori nursing frameworks. Countries like Australia have also adopted it in national health standards. While some regions face resource limitations, the trend shows that culturally informed care is essential to achieving health equity worldwide for all. To conclude, we have two questions for the class. One is, how can nurses balance evidence-based interventions with the cultural preferences of the patients. And second is, what system-level strategies could make cultural safety part of everyday practice, not just theory. For our references, our final slide lists all references used for this presentation, formatted according to APA 7th edition. Thank you for listening. God bless.